everyone. I will hit record. My name is Yasmina Sisrak. I am the co-host of the Healthy Brain webinar series. Welcome to our third webinar presented by the HealthMatters program at the University of Illinois at Chicago in partnership with National Task Group on Intellectual Disabilities and Dementia Practices. We're funded by the Centers for Disease Control and Prevention through the Healthy Brain Initiative. Contents are solely the responsibility of the authors and do not represent the official views of the CDC. Couple of housekeeping items. CEUs are not offered for these webinars. Each live webinar will be recorded and we will make it available to view on YouTube with resources and the PowerPoint deck. We will let you know, send an email when those are up. It usually happens in about a week. And then please use chat box for any comments and questions. We will have about 10 to 15 minutes of question and answer at the end of this presentation. I wanted to introduce today's presenter. They will be presenting on promoting direct support professional resilience, synthesizing findings to make an impact. The presenter is Melissa Desroches. Welcome, Melissa. A little bit about Melissa. Melissa Desroches is an assistant professor of community nursing at the University of Massachusetts-Dartmouth. She's a nurse, researcher, and educator. Her current research interests are around reducing the inequities experienced by people with developmental disabilities, with a particular focus on healthcare provider attitudes and their contribution to poorer health outcomes for people with intellectual disabilities. Today's presentation will be focused on direct support professionals being an essential support for many people with intellectual and developmental disabilities. Despite this, there have been few initiatives to support the resilience of DSPs during challenging times such as COVID-19 pandemic. In this webinar, we present key findings of our research that investigated practices that help DSPs of adults with intellectual and developmental disabilities to be resilient, based on interviews with DSPs who were able to thrive despite the challenging circumstances of the COVID-19 pandemic. Melissa, welcome, and fill in anything that I missed. Thank you, everyone who are attending the webinar.
Thank you. Thank you very much for that introduction and for the invitation to be here today. I'm really happy to be able to share these research findings with you. And I'd just like to acknowledge and thank the direct support professionals who participated in this research study during COVID-19 with everything else going on that allowed us to bring voice to the DSPs themselves. So thank you if you happen to be somebody who participated. So next slide, please. So today I'd like you to be able to walk away or come away from this session rather with at least 3 practices that direct support professionals can use to help them thrive in their role. So if you're a DSP listening, I hope we have some tangible outcomes for you. And if you're a person who employs DSPs, if you're a person with developmental disability, or if you work at an agency, at least 2 strategies that you can use to support DSPs whom you work with or employ to be resilient. Next slide, please. So direct support professionals, if you're not familiar with the term, are people who provide needed supports to people with a variety of health conditions. We use this terminology often when we're caring for or supporting people with intellectual and developmental disabilities. Other names might be direct care workers, care staff, care attendants, PCAs. But when we look at people who provide support specifically to people with intellectual and developmental disability, there's more than 1 million DSPs, the abbreviation I'll use, in the United States. And this was prior to the pandemic. A direct support professional is someone who, again, works directly with people with intellectual and developmental disabilities to help them meet their daily needs. But this is a role that is different from a caregiver, somebody who's providing care. DSPs have a special role where they're supportive. So they're supporting people with intellectual and developmental disability to live in community settings. They're helping them to be engaged community members. So this is different from caregiving. And a very important resource to support people being able to live in the community. Next slide, please. So what we know about DSPs are that they are a stigmatized workforce. They face stigma. Most direct support professionals, not specific to intellectual and developmental disability specializing DSPs, but most are from historically disadvantaged backgrounds. The majority are female, they're of color, they're middle-aged or older, and they are more likely to be reliant on some form of public assistance. So stigmatized because of social status. In addition, direct support professionals who support people with intellectual and developmental disability also face stigma by being associated with people with intellectual and developmental disability, who we know face massive amounts of stigma in society. We know that DSPs are a huge workforce, more than 1 million strong, but they're really invisible in terms of resources and support for them to be able to do their role. They don't garner the same attention that other essential workers or other healthcare professionals garner. You might say the word direct support professional and somebody actually doesn't know what that term means. Next slide, please. So we do have, and we have had a long-standing and massive direct support professional workforce shortage. And this has been documented for decades. Even before the pandemic, this was referred to as a crisis. This was at crisis levels. And back in 2017, there was a report to the president by the President's Council on Intellectual Disabilities that revealed that staffing levels were untenable, meaning they couldn't be sustained anymore because of stress and burnout among the direct support professional workforce. And there were contributing factors that were identified. So very high staff turnover, meaning people are coming into the role and then they might stay a short period of time, usually less than a year, and they're leaving. The population of people with IDD, with intellectual and developmental disability, that they're supporting is aging. So they may have more needs that go along with that in terms of complex conditions. We have fewer direct support professionals entering the workforce. There are low wages, little benefits. We know that the schedule and the time off can be challenging when you're working in somebody's home and there's 24/7 demand for services. High stress, a lack of training. Oftentimes, lay people are coming in and have a week or two of training and are expected to be able to perform a job independently. And then again, that lack of recognition and status for skilled direct support professionals. Next slide, please. So all of that, as mentioned, was documented in 2017 before COVID-19 happened. So before COVID-19 occurred, we had an annual turnover rate of direct support professionals who support people with intellectual and developmental disabilities of 44%. So 44 out of 100 were coming into a role and leaving every year. And so you can see we have multiple news articles, and every time I give this presentation, I look for new articles, and they continue to be published. This is something we're really not making a dent on. Some of the titles, we're beginning to see the collapse of the system, a shortage of direct support staff, the big impact on people with developmental disabilities. So this isn't just a problem because it's harder for the existing DSPs to work and get their job done when they're short-staffed, but the impact on people with developmental disabilities who rely on direct support professionals for their basic everyday needs, including being a valued member of the community. Next slide, please. Yet we find not everybody's leaving, right? Despite really the insurmountable challenges that COVID-19 brought to light, some DSPs stayed and are reported to be thriving. So a research study that was conducted by myself and my team during the COVID-19 pandemic revealed that Many DSPs were flexible, they were creative, they held positive attitudes, they were going above and beyond, despite the challenges that they faced during COVID. Next slide, please. So we have spent a lot of time in research focusing on the stress and burnout piece of our healthcare workers and of direct support professionals. But what we haven't spent a lot of time doing is looking at what helps people to stay, what helps people to persevere through challenges and remain thriving in their roles. And so when we talk about the ability to thrive in the face of challenges and adversity, the term that we use for that in research is resilience. Next slide, please. So when we look at the research literature on resilience of direct support professionals who support people with intellectual and developmental disabilities, there have been 3 studies conducted, and they are actually pretty recent. So since that president's report came out. Interestingly, they're all from Midwestern USA, so not necessarily generalizable to the whole country, but that's okay. They give us our starting basis of knowledge. And so what is known is that among DSPs, resilience is kind of the connecting piece between self-care, what somebody does to take good care of themselves, and how they feel about their jobs as DSPs. So resilience is that connecting piece. It mediates that relationship between what I do to take care of myself and how I feel about my job. Another finding is that direct support professionals who measured high on indicators of resilience were motivated by specific things. They were motivated by their families, they were motivated by their social relationships, and they were motivated by a desire to contribute and to improve and to better society. And then finally, the third finding in the research is that as resilience increases in DSPs, the level of emotional exhaustion or the frequency of emotional exhaustion decreases. So as we can increase resilience, we can decrease emotional exhaustion. Next slide, please. When we look at the research on interventions, on what people are currently doing to promote DSP resilience, and this is from the research, so not necessarily all of the things that might be going on in individual agencies that haven't risen to the research journals, but we found 2 studies that have looked at evidence-based practices for DSP resilience. Now, both of these came out of the United Kingdom, so we haven't found anything in the United States. One study showed that a 2-day mindfulness and emotional coping training helped to reduce direct support professionals' psychological distress. So not resilience specifically, but kind of related, right? Their psychological distress. And then another article looked at a brief resilience workshop, and it didn't say how long the workshop was, but it was related to challenging behavior and how to manage challenging behavior. And that study found that DSPs who had that training were able to decrease their emotional reactions to the challenging behavior. So there's some evidence that these interventions related to resilience can have positive effects with DSPs. However, we actually haven't measured that resilience itself. And theory about resilience hasn't guided these research studies. So we're close. We're kind of coming at it from all different lenses, but we haven't gone straight for the concept of resilience or thriving during challenge. Next slide, please. So this is what we identified in research. We always look for our major gap in the literature, meaning where is the hole? What is the big question that we're trying to answer? And so our big gap, our big hole was that we found no studies that examined DSP resilience or what helps direct support professionals to thrive during challenging times from the voice of the direct support professional, meaning nobody has asked them and published that. Next slide, please. So that is what we sought to do through our DSP Thrive research study. My co-investigator, Dr. Marinda Tayo, here at the University of Massachusetts-Dartmouth. Together, we had funding from our university for an internal funded study. And so we looked at what are the practices that contribute to the resilience of DSPs who support people with IDD. And so basically, we conducted qualitative telephone interviews using Zoom technology. And this was last year, so February to August. It was hard to get to people during that time during COVID out of respect for how busy people were. The summertime made that a little bit easier as we had a dip with the COVID cases. We ultimately were able to speak with 10 direct support professionals who were referred to us by their employers, in some cases themselves or their peers, for being very resilient. Somebody saw that in them, or they recognized that, yeah, this is me. We invited them, or we had recruited them by sending email flyer invitations to developmental disability service provider agencies and through nursing contacts through the Developmental Disability Nurses Association. A lot of nurses work with direct support professionals in their agencies. Next slide, please. So of the DSPs who responded, our sample of 10, we had 90% were female, we had one male, 80% were white, one was African American, one was Cape Verdean, 50% worked in group homes, so we had a large representation of residential care staff. 70% were from the Northeast. The age range was 20 to 51. And the years of experience varied between 1 year of employment to 16 years of employment as a direct support professional. Next slide, please. Okay, so our findings. We ultimately, through this study, found 5 practices that contribute to direct support professional resilience. So these are practices on the level of the DSP or even within their agency, but we didn't address broad factors like pay, salary, occupational workforce status, things like that. So I'll preface the findings with that. Next slide, please. So the first practice that DSPs identified as very important to helping them thrive was communication. And communication encompassed communication with the people that they support, with the families of the people they support, as well as other DSPs and staff. So the ability to make a meaningful connection with the people that they support, and specifically a lot was said about people who don't use verbal language, that was identified as very important. Being able to make that interpersonal connection. Also, communication that supported the ability of the DSP to understand what's the bigger picture of what's going on with the person. So they talked about getting their shift report or reading their communication log for the day after they were getting somebody home from day program. And instead of just hearing about what happened, on the ride home, looking at, okay, well, the last 2 days when you weren't here, this is what's been going on with Jim. He's been really upset because his family didn't come to see him last week, and getting that bigger picture. That way the DSP was more prepared to be able to communicate and engage with the person in a way that was meaningful. Communication, again, also related to relationships with the staff and being able to just have a brief time to vent with a trusted colleague. And the idea was to vent and move on, not to dwell on it, but to briefly get something off their chest with a trusted colleague. To cope with stress was very important to them. And usually that colleague was somebody that they respected, that had been in the field for a long time and could also give that broader perspective related to kind of putting the day's events in importance. Communication was also a foundational aspect of teamwork. Teamwork was another major finding that really went under the umbrella of communication, but bears need to be highlighted. Teamwork was important for the DSPs among themselves to provide care that was safe and effective. They talked about the impact of having a lot of different staff rotating in and out of the team and having a consistent team where people could trust each other and where the person supported also could trust the staff and knew how to communicate was very important. And then teamwork with the people that they supported, particularly in group settings, in the day habilitation setting, and out in community settings. So building a sense of team that, yep, we're doing this together. And what would the team like to do? And okay, we're going to trade off. If we don't get to do this activity, let's vote as a team, and then making decisions as a team. And so there's a quote that really encapsulates, or I don't know if that's the right word, but what communication is all about in light of this study. And the idea that you need to listen, you really need to listen. I listen to the clients, I listen to them. I sit back, even in our conversations, when they're having conversations amongst each other. I listen to them, and that's how I learned. And that's how I learned the different things that they like and what they say. And so I listen and I learn. So, really, that you are not just doing tasks, but you're communicating to know and understand another person and to build a sense of teamwork. Next slide, please. Self-worth and recognition was our second major finding, and they're not really in any order, not any ranked order. But it should come as no surprise that positive recognition is important to DSPs to thrive. And this recognition can come from people that they support themselves. It may be the family members. It may be the agency leadership. Oftentimes, agency leadership wasn't who the DSPs were talking about. It's when they got that feedback from family members or from the people that they supported themselves. In general, the DSPs prefaced describing this need with overall talking about how they really didn't feel valued in society and how people don't see them, they don't think their role is very important, and that really weighed heavily on them, that lack of societal value. And so a few strategies that they identified. One was when agency leaders took the time to listen to what the DSPs had to say, and not just in a reactive way, but through purposefully engaging with the DSPs and including them in decisions that affected people's everyday lives. And then also followed up, made changes, or came back to them and said, okay, I looked into this and this was the outcome and this is why. But having that follow up. Again, the positive feedback from the people that they supported as well as the families, that again was very much linked to meaning with them, that they were doing something meaningful and having self-worth from helping others. And so a positive impact, that positive impact piece was a major piece of what helped people to stay and thrive despite challenging times. Next slide, please. So going along with that communication piece and with the meaning piece, really getting at building an authentic and equitable person-to-person relationship with the people that they support, with the people with intellectual and developmental disability. So not having, I'm a nurse, so not having like a nurse-patient relationship or a provider-client relationship, but having really a person-to-person relationship. So if you're in the healthcare provider world, this person-centeredness, getting to know the person as a person first, and as an individual. And it was highlighted that getting to know the person based on your own experience with the person is important, because a lot of bias the DSPs reported is spread among staff about different aspects of supporting different individuals. And so they reported that oftentimes, they may hear this or that about an individual that they support, but when they actually meet the person, when they actually engage, they haven't had that problem at all. And you think about this in our everyday workplaces, there's certain people, individuals that we blend with or we don't blend well with. So this shouldn't be any surprise when we blend multiple people, when we blend people with IDD and DSPs, that of course some people are going to align and some people aren't. So just having that recognition that I need to make my own relationship and gauge from my own experience. The other thing was emphasizing that respect and the shared humanness. And the quote on the side here, they're people just like we are. They may have a disability, but they're just like we are. So the people that were thriving were able to see that, kind of cutting through all the baloney on one person, supporting another person. The DSPs had to do some discernment though, right? Because although there's that equity in the relationship, still direct support professionals, right? So we're doing a service, these DSPs. And so recognizing that although we want to build an equitable relationship, it's not really about me and my need. I need to discern how much of my real life is appropriate to share. What things can I tell this person should I not share with the person? Um, Sugarcoating was something else that these DSPs talked about, the opportunity for people to make choices and try, even when there is the possibility of failure or being let down. But the idea that if I walk in and say, everything's going to be fine, don't worry about it, or giving sympathy, a lot of sympathy and not reality, didn't help towards that equitable and real relationship. Next slide, please. So embracing change and learning, this was a big one, and it may be because of the COVID-19 pandemic. It may not be. It may be a longstanding finding. More research will need to weigh that out. But ultimately, the DSPs talked about how their role can be really very unpredictable. It can change according to who are the people that you are working with and you are serving in a given day. If you are moved to another house or another location, or somebody's health status changes that you're supporting and you need to learn new skills. So flexibility and adaptability, very important. And the recognition that this is to be expected, that this is just part of the way it is. Change is happening. The idea of letting go of control too, that there is going to be somebody else that's going to do something and it's going to be different than the way that I do it. And it's not that that's a bad thing. We can have two different methods and they can both be okay. Now, obviously, there's a little bit that goes along with following policy, but when there's not a breach of policy or anything like that going on, the recognition that it doesn't have to be my way or the highway, right? We can both have our own way is important. Putting a positive spin on changes. So looking at change as an opportunity to grow, as an opportunity to learn perhaps new skills, to have a new tool in the tool belt. And along with that, reflecting on what can be learned from past experiences. So a lot of self-awareness and introspection and looking at how can I learn, how can I grow? Training and education was spoken of by a lot of the DSPs as important, particularly when they were newer and related, or they had rather a newer requirement. So it's something that was new to them. Maybe they're not new in the job, but now they're doing something new, or they need to provide a new care task. So the ability to have training and to feel that they were well prepared helped them to thrive. As mentioned before, really tailoring what policies may be in place and finding one's unique style. Kind of how do I do this? And to have that self-efficacy that I have my own way and I'm doing this right and I'm doing a good job and I can shift and I can adapt and I can pivot, but I can kind of own this and have a little pride in that. The quote here talks about change happens every day and you just have to roll with it. And I think that sums up well this practice. Next slide, please. So boundaries was a big one with both people and time. So respecting the boundaries, not of the DSP, but the DSP respecting the boundaries of the person with intellectual developmental disability that they served in terms of their communication, in terms of maybe their values and beliefs. So some examples of this, DSPs described times when it would have been easy for the DSP just to tell a family member kind of what went on about an incident that happened. And so that DSP, that family member can know, you know what, that DSP didn't do anything wrong. Everything's okay. But the recognition that that's kind of paternalistic to not give somebody the opportunity, not to give the person served the opportunity to describe what happened in their own words. And then that really limits that person's freedom. So recognizing, you know what, this is a boundary. I'm going to have of course, encourage this person to give their account of what really happened. And then I'm going to fill in the gaps and I'm going to assist. But having that boundary around communication, that this is their relationship with their family member, and I'm going to support that. And I'm not just going to kind of dive straight over. Another example related to boundaries around communication and family members that came up was something that was watched on television about death and dying. And the person was asking about, the person supported was asking about heaven and what happens when people die. And the DSP was very cautious about, well, how should I approach this? This isn't my family, right? And this family that I'm supporting, the individual and the family, has values and beliefs. And so how should I address this? And so having that open communication with the family was very helpful and a source of support to the DSP to know that, what I'm doing is in line with the desires and wishes of this individual and this family. Another boundary related to setting boundaries around when the DSP was available in terms of to communicate with people served. So now we know we're in the time of Zoom and WebEx and text messaging, and it's not just what goes on during a typical workday. And so we have DSPs that people text them, they're 5 a day, the Special Olympics, five fruits and vegetables, 5 glasses of water. I don't remember all the other 5 things. And then they might get upset when the DSP didn't text them back right away. And so the DSP really had to set boundaries around that. Like, okay, if I don't respond to you, it's because I'm probably helping my mom. I care for my mom, or I might be doing something with my husband. So just know you can text me, but I might not get back to you right away. I'll see you tomorrow morning. It'll be okay. And setting that expectation. Others had other policies about, where and when they would have that interpersonal communication. Another boundary related to work hours, of course, but in terms of scheduling. So learning their own limits in terms of how much overtime is too much overtime. Who are people supported that the DSP, it's too draining for them to work with on a regular basis, or too many shifts in a row, maybe because of challenging behaviors or just personality mismatch. So placing limits on that. And that involved recognizing, what are the symptoms of when I'm getting burnt out? What changes do I see in myself that are warning signs for me that say, hey, I have to put the brakes on, or I have to speak up to my supervisor and say, you know what, I'm happy to work an extra shift, but I can't work it in this residence with this person. You got to try to move something around. So the boundaries are very important in many, many different ways. Next slide, please. So intentional mindset. One phrase that came up quite a bit was, you got to leave your problems at the door. Leave your problems at the door. It was a conscious daily decision that these thriving DSPs made not to bring their problems from their personal lives into work. And it was interesting because more than one person used that exact phrase. So something really to consider, I think, for all of us. What can we leave at home that we don't need to bring into our work lives? I mentioned that sympathy piece before, and that DSPs weren't sympathetic towards people with IDD. And I know that might come across as startling, but the idea of sympathy that these DSPs shied away from was feeling sorry for. So that sympathy being when you are sorry for someone, when you pity what someone's going through, when you're sad for what somebody's going through, versus having an intentional mindset of being empathetic. So empathetic being, I am viewing this situation from the perspective of the person. If I was this person, and according to how best I know this person, what is this experience like? What is this perspective like? Because there was an awareness that in society, there's a lot of sympathy, right? A lot of sympathy, a lot of feeling sorry for, a lot of feeling like people are suffering or we need to pity. Not the case with these DSPs. They saw strength, and they were empathetic to the fact that, yes, certain things may be more of a struggle, but how can we recognize that and work together and move through these challenges versus just, it's okay. That goes along with that sugarcoating finding. It's okay. You can't tie your shoes. I'm going to tie them for you every day. That's what I'm here for.
Empathy might be like, all right, this is a challenge. How can we work through this together? What can we do to get this job done? And then look at a variety of solutions. It's to not be dependent. Another focus of intentionality, of being intentional, a conscious choice, was calmness. Really cultivating an inner calm as opposed to being reactive. So it links to being able to take that broad focus when we talked about communication, looking at the big picture. Because when you can recognize, it doesn't help anybody to go tit for tat in the moment and to go back and forth and to try to win, try to come out higher in terms of power. You don't want to get into a power struggle, and being able to take a step back and detach and maintain that calm was very helpful to the DSPs. Ultimately, recognizing that the DSP's mindset, all of these elements of mindset, set the tone for the day for the person or people supported, whether that be in the residential setting or day setting or community-based services. But really, that DSP is influential for what kind of day not only the DSP has, but the people whom they support have. So that cultivating that positive atmosphere was very important. Next slide, please. So one of my favorite findings to come out of this study was humor and fun. And this often did not require much effort, according to the DSPs. It was just a natural outpouring of spending time with people with IDD. And the DSPs reported that people with intellectual and developmental disabilities, they find generally to be good-natured and to enjoy, to be fun people to be around. Of course, there's always unique differences, but just in general, that this was a group that likes to have fun. And so, when faced with something challenging, when faced with a conflict or a potential difficulty, the direct support professional often used humor to distract from the situation or deflect. Deflect was a word used a lot by the DSPs related to humor, and really retain that lighthearted atmosphere. So, again, rather than going at things with a power struggle, with negativity, with force, using humor. For the DSPs, using humor, even on themselves, making fun of oneself, really allowed them to be able to move from anger and frustration and to give them a little distance from the situation so that they then could laugh at it. So finding something funny. In order to do that, you have to be able to distance yourself from the situation a little bit. And so that was a skill that these DSPs learned. They made fun of themselves. Sometimes the people that they supported with intellectual and developmental disability playfully made fun of them as well. And so they'd kind of rag on the DSP a little. But again, that this was a daily practice. The DSPs talked about too, and the quote on the right here illustrates, in many cases, some of the settings where people with intellectual developmental disability are spending their time, whether it be in their home and we're asking them to take care of their homes and do chores, or in day habilitation settings where they're not getting paid, but we're having them work on daily goals, right? What's the real incentive? Going every day, what's the true incentive? But that when you can make something fun and you can make something engaging, that you can get the work done, and it can be a positive experience. And so some of the things that helped the day to pass in a fun and lighthearted way would be telling jokes, celebrating different holidays and events, asking the people themselves that they work with, that they support, what do you want to do that's fun? What would be fun to do? Not always having to be the one to come up with something. The teasing, and just really celebrating each day as an opportunity to have fun. Next slide, please. Self-care. No surprise that this finding came up. We saw this in the literature review. We know that resilience mediates the relationship between self-care and professional quality of life, which is related to resilience and staying in your role. And so, as the quote says, if you can't take care of yourself, you can't take care of nobody else. And ultimately, the biggest self-care strategy that DSPs discussed was having time for what matters most. And now, what matters most varied by the individual. But the idea that how they were spending their time, they were prioritizing what matters most. So not mindless stuff, not fights or squabbles on the side, but that they were taking time to really fill their cup. And so these strategies differed, but some of the things that were in common among these DSPs were spending time with loved ones who may be human or they may be pets or furry or birds. Exercise was mentioned by a couple, hiking and being out, hydration, so just making sure to get in enough water, reading, kind of mindless reading, meditation, personal grooming. Somebody talked about when you're working multiple shifts in residential, going home to take a shower. I mean, like, yeah, that's important. And that actually was role modeling to the people that they supported that, yeah, the way I take care of myself is important. It helps me to feel good. How I present myself to others is a reflection on me. Going out for a drive to get coffee. The DSPs talked about how self-care didn't necessarily always have to be time spent alone, but that some of these things they enjoyed doing with the people with intellectual developmental disability that they supported. Things like the exercise, going out for walks, walking the track, hydration, encouraging that you could encourage each other. Meditation was something that was also done together. A big finding, and again, I don't know if it's COVID specific, we'll need to look at it in the future, is nature and the emphasis on nature. Time spent in nature was self-care among multiple DSPs. And there are many research studies that show the impact on stress levels that spending time in nature helps to reduce. So this was something that wasn't always going outside or going on a hike or going to a park, although DSPs did talk about going outside, but sometimes sitting by a window and watching the birds and really having a mindful moment, just being part of nature, looking out at a tree and noticing what are the different birds, what are the leaves looking like, but linked with mindfulness, that being in the present moment, being in nature. And then, of course, no surprise, venting, speaking with, spending time with friends and loved ones to de-stress. Next slide, please. Our last of the 9 practices is spirituality in the bigger picture, that link to meaning. So some DSPs did make direct reference to practices of faith or prayer or spirituality connecting with a higher power. Others talked about self-reflection and learning and growing in light of some larger meaning for being, that there's a bigger force in control than me and my individual life. There was this talk of at the end of the day. Multiple DSPs use the phrase at the end of the day, and not at the end of that work day specifically, but at the end of the day, I have to do what's right. At the end of the day, I'm focusing on what's important at the end of the day, as opposed to really taking a very short lens, like right now, I have to do this right now. At the end of the day, what's the big picture? DSPs, a lot of them talked about that they felt that they were meant to be a DSP at that time, that this is something that was really meant to be in a metaphysical way. And they often saw that challenges gave them a greater appreciation for what's truly important in life. So challenges that they may have personally experienced that led them into working as a DSP, or personal challenges that they faced in their role. But that sometimes these challenges really did help them to focus on what's important. And so here the quote talks about paying attention. And so I turned more into spirituality, not questioning life or reading articles, but really paying attention. So that mindfulness and focusing really on like what's important, being awake to that. Next slide, please. So now you've seen all 9 practices that our DSPs shared with us. And so we're going to put them kind of in the context of what we already know about resilience from other health professionals and resilience among people with intellectual and developmental disabilities, which has been more well studied. So we did find that there's some overlap with factors among other healthcare professionals like nurses the focus on the positive mindset, learning, self-care, paying attention in the present moment, the social connections, so a lot of overlap there, and overlap with people with intellectual and developmental disability and their resilience, that social network, but the importance of leisure activities, fun activities, and accepting challenges and changes with a positive attitude. An interesting finding was that our study showed that direct support professionals were more resilient when they could let go of control, and that persons with IDD were more resilient when they gained a sense of control. So you can see how those two findings complement each other. What needs to happen for both to be resilient is a shift in that control. Next slide, please. So our study does have limitations. So the strength is this is the first study to look at direct support professional resilience from the perspective of DSPs. However, we had difficulty recruiting during COVID-19. Our sample ended up predominantly white and from the Northeast US. So just like we had looked at the previous literature, it was largely from the Midwest. This study is largely from the Northeast. Also, all of these direct support professionals were employed more than 1 year. So they may or may not accurately remember the things that helped them to be resilient earlier in their career. And because this study captured the experiences of DSPs at one point in time, we're not able to track for changes over time in how people may feel their resilience changes or what contributes to changes over time. Next slide, please. So if you are a direct support professional, how can you use these study findings in your practice? So getting out what helps us to build habits, because ultimately it's about building habits. So selecting one of the practices that we talked about today and setting a goal to incorporate it into your daily routine for 3 weeks. And 3 weeks is usually the time frame we use for what it takes to build a habit. And what I'm quoting here is not my own work in these colored boxes. This is Atomic Habits by James Clear. I don't know if you've had the opportunity to read it, but I highly recommend, if you're looking for a way to build a habit, to check out this book. You want to make your new habit obvious. So you want to leave your problems at the door. Make it obvious. Is there something you can put? Can you put a sign at the door to leave your problems at the door? If you're trying to infuse more fun and humor in your day, can you get a newsletter that sends you jokes or positive stories each day? Can you get a notification like that? Making it rewarding. So if you're trying to do something and it's not easy for you, a new habit, pairing it with something that you love. So for instance, if you want to start a morning meditation practice like I have, do it before you do something you love to do. So you get to do what you love to do when you do that practice. So I meditate and then I love to snuggle my warm golden retriever before I have to get my day going again. Make it easy. Don't set yourself up with a habit that you're going to have this complex plan. Commit to trying something new or doing something new for maybe only even 2 minutes. So you're going to exercise. I'm going to go every day out on a walk for 2 minutes down my street in nature. Chances are, if you can commit to telling yourself, I'm going to do this for 2 minutes, once you get going, you're not going to stop after 2 minutes. You're going to keep going. And then make it satisfying. Sometimes we don't see changes right away. It can take a little bit of time, especially if we're getting 1% better every day. It can take a while for those changes to stack up. So just like we use positive behavioral supports, oftentimes with the people we support, we can build in rewards when we reach our habits. So rewarding ourselves when we are able to build these habits or a habit into our daily routine. So that's when we have like our check mark calendars and things like that. So some ideas as you look at how to implement changes to your routine to be more resilient. Next slide, please. So what can DSP employers do? So really encouraging activities that focus on DSP well-being and resilience within the workplace culture, which can be hard, I know, when you're short-staffed, but ultimately these are the things that people are telling us help them to stay. So it ends up being worth the investment. recognizing direct support professional strengths and accomplishments, both formally and informally. So any way you can recognize a job well done, this is what DSPs are telling us, helps them to thrive and stay. Ensuring training. Training communication is a big piece. So looking at meaningful communication, building relationships, not just the tasks like the check off things that, okay, you had vital signs training and you're MAP trained, but actually what are the things that people really need to know to thrive and succeed in this role? And peer mentoring is something, a major opportunity where we can support. You know, DSPs talked about having a trusted colleague that they can vent and bounce ideas off of. This is an opportunity, peer mentoring. We talked about asking DSPs for their perspectives and following up, and then supporting DSPs to infuse humor and fun and leisure activities into their daily routines. And so looking at how can we support this? And this isn't so that the DSP's day is more fun necessarily, right? But this is so everybody's day can run smoothly and we can support the well-being of not only the DSPs, but the people with intellectual and developmental disability who we serve. Next slide, please. And then whenever I speak about resilience, I want to highlight resilience is at the individual level and potentially the interpersonal level, meaning this is something, these are practices that a DSP can do and that an agency can support a DSP to do. But there is a lot that goes into DSP turnover that is external to the DSP. And so it's important simultaneously to us supporting DSPs to be resilient and to sharing this information with them, we need also to act to affect some of those systemic changes that need to happen to support DSPs. We need to address the low DSP pay rates and the lack of recognition that DSPs who support people with intellectual and developmental disabilities have. They're not a federally designated workforce. We don't have a lot of data and a lot of initiatives to support them. So how can we do this? Of course, like any other political advocacy campaign, who you vote for people that will support the DSP workforce. Contact your legislators and tell them about your experience as a DSP, employing DSPs, as a person with intellectual or developmental disability who has the support of a DSP. And then one of the ways that I find the most easy for me to advocate is by partnering with advocacy organizations like the ARC. My local ARC chapter in Massachusetts really helps to clearly see these are the issues and these are some of the things we're doing about it. And they kind of get the ball rolling for you so you don't have to invent the wheel yourself, or reinvent the wheel, I guess is the phrase. Next slide, please. So just a reminder that not doing anything is a choice, right? You're doing something by not doing anything. So let's be the change to really change the culture for direct support professionals towards resilience so that we can ultimately provide the best supports that we can to people with intellectual and developmental disabilities so they can live the best lives possible. Thank you. I'll take any questions.
Thank you so much, Melissa. Please let us know if you have any questions. One of the questions that I have is, so what are your next steps? Are you planning on turning this into a curriculum, larger study? Tell us more about your next steps.
Yeah, so we're looking at our next steps. Initially, our thought was to develop a cell phone app to support direct support professionals. Because one of the things that they talked about a lot was the need for that social connection. They're isolated in many ways. If they're working in a residence, they might be only them on or one or two staff, or they're out in the community. But there exists the need for us to look at this from a diversity lens too. Our sample was largely white and from the Northeast. So looking at cultural differences, racial, ethnic, gender related, we need a broader sample of resilient DSPs, but ultimately in some way, yes, some type of curriculum we need to develop, and then to decide what is the best way to implement that. Is that an in-person training? Is that through an app? Is that through some type of more formalized mentorship? But so we are looking at grant funding to further develop this work as we move forward.
Thank you. So one of the questions is, what is the role of nurses and community providers in recruiting and retaining DSPs? I know you're a nurse, and how did you come about to really focus on DSPs in your role as a nurse?
Yeah, so that's a great question. I did follow up after this study and speak with multiple agency providers and advocates for DSPs, including members of the National Alliance for Direct Support Professionals. And through conversations with them and some of my own research, there can sometimes be tension between nursing and direct support professionals. We don't always have, like, it's not a clear chain of command. Nursing doesn't necessarily oversee direct support professionals. Direct support professionals may not answer to nurses. Nursing is the medical model, right? We're carrying out, in many ways, we're perceived to be carrying out medical care, and direct support professionals support people with disabilities, not necessarily with healthcare. So there can be some tension there. But I think we have a great opportunity as nurses to be allies to direct support professionals. And this is not my idea. This comes from John Raphael at the NADSP, but he brought up the idea that not too long ago, nursing was in the same position that direct support professionals are in right now. I mean, 100 years ago, if you were a nurse, you were likely an alcoholic or a prostitute. And nurses were looked down upon in society. And it took some organizing to show this is the value of a nurse and this is what a nurse does, and to gain that visibility. And so I think as nurses, having just gone through this is a way we can support DSP, speak to the value of what a DSP does, and try to get over some of that tension. You know, tension can be because we're all oppressed, right? We don't have the time to do what we all need to do in our jobs. We're not all getting compensated the same way according to our value, but recognizing that we're all there for the same reason and trying to overcome some of those barriers, I think is a really important direction we can move in the future, to really be an ally to DSPs.
Thank you, Melissa. Beth, any other questions that you have? Oh, one of the questions is, what messages does nursing need to be an ally?
So I think to be an ally, I think nursing needs to recognize, and I think in many ways we do, we need to recognize that there is a diversity of people coming into the DSP role, and recognizing that we need to have some empathy to that situation, right? That what one DSP may be able to do, another DSP may not, and that we can advocate, but that as nurses, we're educators, right? So I think education is a big message, that we can be part of the solution through education. But ultimately, I'm going to go back to that intentional mindset and some of these resilience practices. Knowing that you're available and you're an ally and you're positive and you're not out there judging everything the DSP does. That's something that the DSPs, some of the DSPs talk about, like feeling afraid of the nurses, like they're going to eat them, almost like they're our young nurses. We talk about nurses eating their young. So having that mindset that I'm going to be an ally, I'm going to help to educate, versus, and I know it can be challenging, definitely with certain situations, but really having that mindset that we're going to build up and we're going to work together.
As a follow-up question, what can community members do to support DSPs?
I think really your political advocacy, and your recognition. So some of the things that we saw during COVID-19, we saw the signs for healthcare providers. Some of the things, I'm on the board of directors newly for an agency in our community. And one of the things I was told, and that I saw when I pulled up the first day, was signs that said, "We love our DSPs," in front of homes or in front of the day services, that community members had put up, that neighbors had put up. And so knowing that, okay, people know about us and they appreciate us. So in whatever way you can show your value to DSPs, can show your appreciation of their value to DSPs, That's huge just because the societal recognition is so low. And then, of course, that advocacy. We have different laws that look at the pay grades for DSPs that are renewed every so often. So, kind of looking into that, I'd say partner with your advocacy organization. And generally, the ARC chapters are all about supporting the DSP workforce. And so, if you can kind of follow their updates, and they'll send, I get text messages that say, please vote for this or vote for that, or let your legislator know, or send this letter. They'll populate the letter for you, and it'll automatically send to your legislator. So that's probably advocacy and showing your value, showing their value. I think are the two most important things.
Melissa, thank you so much for this presentation. We really look forward to hearing more, and hopefully you will be able to expand the project in the future, and we will be in touch, and hopefully you'll be able to come back and present on the new research and new results. Thank you for everyone who attended today. Please join us for our next webinar next Tuesday. Beyond Access and Inclusion, Belonging in Healthcare for the Population with Intellectual and Developmental Disability. I put in the chat box the registration page. Thank you again, and have a great and happy holiday, everyone.
Thank you.
Bye.
You too.